The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome, TMD Warriors. I am Tony Urbanic, and we are gathered here for the next installment, the next episode of TMD Demystified. We're going to jump right into today's topic, which I find very relevant for all of the doctors out there who are currently using the Urbanic device and protocol. And I'll tell you why in a moment, and it is extremely important. We've worked with this issue in our practice and ferreted out exactly the stops and barriers and the difficulties both the doctors and the patients have had in understanding and using the device, which is quite simple to begin with. But the point is, all the details have already been worked through, and that's one of the reasons why I spend these episodes, these short 30-minute clips, explaining to those who are interested what I've learned and why it's so important. It's also designed for people who are interested in doing it and adding it to their practice and for their patients and their own practice, because this information is solid gold. It's extremely valuable. So today's topic is importance of the patient knowing how the device and protocol works. It's not magic. The importance of the patient understanding how the device and protocol works. Now, first of all, I've had many patients, once their symptoms diminish, go away, they've had these symptoms for 10 years, 20 years, 30 years, 40 years, look at me and they go, this is magical. This is amazing. It's magical. I can take that as a compliment. And I did the first many times. I mean, it's more than a few times. The first half a dozen times, that's quite complimentary. But I've learned over the years that that's really not a compliment because they think it's magical. They have no idea how it works. And that is not right. That is not effective. That is not getting us where we want to get when it comes down to solving this big dilemma, bag of worms when it comes to TMD. And I'll say it again, and I'll stick by it. I figured this out. And my associate who helps me in our practice applies what I know, and now he's figured it out. So those of you who are thinking about coming on board and becoming network providers really need to understand this thoroughly. It's not rocket science. I don't go into complicated explanations, and you don't have to take notes. It's important that the patient understands it, because if they can visualize, and people think in pictures, by the way, and just keep that in mind, people think in pictures. So you have to, whether it be you working through a problem of any kind and thinking through the pictures associated with it, or the patients who are not as sophisticated as you, the doctor or provider, by any means, but they are thinking in pictures. And if you can get them to visualize what's going on, how you're helping them, how the device works, along with the protocol, and they can actually see it in their mind in some form of pictures, whatever that picture is. You don't know what the picture is going to look like, but they have a picture of their joint, however you describe it. You might have a model to use of some kind, a model of the device itself, but the model of the device itself does not do justice to how this thing works. They just see this little piece of plastic. And of course, I've had hundreds of patients that go, you mean this little piece of plastic is going to make my shoulder pain go away, or my ringing in my ears go away, or my migraine headaches that I've had for 20 years go away? And you go, yes, ma'am. Yes, sir. Yes, ma'am. It will. But then you're dedicated. You must explain to them in terms that they can understand, but more importantly, terms that they can visualize some kind of picture in their mind of what's going on with this thing and protocol. I hope I made that point. I can only repeat myself in a couple different ways, but it's extremely important that you understand, because I've learned all this talking to thousands of patients with this problem. You know, I have to admit, let me digress for just 30 seconds again. And I've said this before, as a maxillofacial surgeon, I did 2,000 surgeries on these joints, half of them open joint surgery, visualizing the joint with my eyeballs, and half of them through an arthroscopic scope, doing the things that you can do through a scope. But, you know, I spent so little time talking to the patient and almost no time listening to the patient, other than it hurts, what their symptoms are, and then applying whatever the local recommendations were, what the textbook said, what my colleagues said, what the conferences said on temporomandibular joint surgery. But I spent very little time actually listening. But I learned almost all of what I have to teach and what I have to say, mainly by listening to patients and watching their reactions and listening to them carefully, how they respond. I'm trying to pass this on to you so it can help you treat patients better and actually solve this problem on a patient-by-patient basis. If you get enough doctors who actually solve the solution and enough patients who are actually treated correctly, it will go viral. It will go viral. And that's the objective. So it is extremely important that the patients can visualize what's going on there. Well, we talk about a little bit about the reasons, but let me just jump in. I spent a little time developing a little diagram of this, which I'm going to share with you on my screen, I believe. Okay. So again, I told you what I think of patients who talk to me about this thing being magic. All right. Again, a nice compliment. But frankly, I think that is an indicator that they have no idea what's going on. So here is the simplicity of it. I've made this little diagram, and we're going to talk about it and kind of unpack it, develop the concepts behind it. And this is nothing new for those of you who watched other episodes, but pulling the concepts together and making it real so that you can actually offload this same information to the patients and get them to visualize. All right. So here's how it's not magic. It's the inflammation in the temporomandibular joint causes the symptoms. We know that. The inflammation causes all the symptoms. It's not myofunctional. It's not magical. It isn't problems with the nervous system. It isn't how much or how little they brux necessarily, although obviously bruxing is the primary one, of the three causes. General causes of inflammation in the joint, bruxism is the most common. But let's just start out at all the symptoms are caused directly by inflammation in the temporomandibular joint, including tinnitus, subjective hearing loss, and vertigo, including arm, hand, finger tingling and numbness, including migraine headaches that occur all over the place that the patients describe, and all the other symptoms. So it all boils down to inflammation. Now, if you unload a joint, like a set of knees, if you have inflammation in the knees and you don't want to go and get surgery, or you don't need surgery, or the doctor says, well, we can do these complicated things, and you say, what can we do that's more simple? He is going to give you a set of crutches and say, get off the knee. And what happens, because the symptoms of knee problems originate from inflammation in the knee. It isn't necessarily bone on bone, although bone on bone is bone on bone. But what's bone on bone in the knee does, it creates inflammation. So he will give you a set of crutches. Now, this device that you can see does nothing more, nothing less than take the excess load off of the temporomandibular joint, like a set of crutches takes the load off the knees. That's it. And a patient, when you say that, they can visualize their knees, they can visualize a set of crutches, they can visualize, well, this thing goes in my mouth, and because 90% of the loads on the temporomandibular joint come from the posterior teeth, they can visualize how that device is like a set of crutches which unloads the temporomandibular joint. When you unload the temporomandibular joint, it decreases inflammation, just like a set of crutches would decrease inflammation in the knee. And then as the inflammation goes down, which is a gradual process, as you know, it would not happen overnight, but as the inflammation goes down over a period of time, which is the critical nature of the protocol, easy to bring out, the protocol is as important as the device itself, because you have to use it as a tool. You use the tool correctly, you'll get the response. And so you emphasize to the patient that as they unload the joint, the inflammation dies down. As you use this set of crutches for your temporomandibular joint, the inflammation will diminish. And as the inflammation will diminish, the symptoms gradually diminish and go away. It is that simple. And patients can understand this description, this explanation, because they can develop their own picture of a set of crutches for the temporomandibular joint. And then you can get as fancy or as complicated as you want and compare it to whatever the X-ray, the Panorex shows, or if you have a cone beam CT, and whether or not the joint has any distinctive damage areas. You can bring them out, but you can emphasize that we're not treating an X-ray, we're not treating a cone beam CT, we're treating inflammation, and you can't see inflammation on an X-ray. And it really makes no difference how bad the joint looks on an X-ray, because we see consistently really nasty looking degenerative joints where literally half of the condyle is gone, or the patient complains of locking, where you know the disc is actually dislocated anteriorly for sure. But again, as you allow the inflammation to go down, the synovial fluids gets back to more normal state. Its ability to be effective within the temporomandibular joint gets better, lubricate better. The disc comes back into a normal position. And again, all these things are discussed in detail on previous episodes. I don't want to, go over all of this stuff too much, but in this particular episode, I'm trying to make it simple for you, the doctor, to use the basic information here to explain it to the patient and why it is so important for the patient to have that visualization of what's going on here. And if they come back at you and they go, well, it's magic, well, your response should be, yes, thank you very much, but it's really not magic. I hope you really understand that all we're doing is unloading the joint like a set of crutches would unload the knee. Oh, yeah, I get that. Yeah, that's what they'll say. I get that. That's easy to understand. When they do that, it'll have several effects. Number one, they can describe it now to their friends and family in terms that they will understand. And we already know from our experience in this practice that once these patients are back to living a normal life after 20 or 30 years of headache, earache, ringing in the ears, shoulder pain, neck pain, etc., they want to tell all their friends about this. And we get a significant number of referrals by that method. But what I also know is that, if they just say, well, it's magic, the person on the other side is not going to be driven to actually avail themselves of the service, they'll go, well, I don't know about magic. I don't believe in magic. But if the patient can tell their friends and family, this is just like a set of crutches. It unloads the temporomandibular joint. You have to use it correctly. You have to start out 24/7 for 2 months. Then you go to nighttime only. And they can describe that for someone else who has similar symptoms. It is highly likely, it is much more likely that that patient will show up at your office requesting services, which is the great thing. We're out there to solve this problem. You should be out there to solve this problem for as many people as possible. And that is my message. And a secondary benefit is that, patients are not sophisticated medically. I was talking to a nurse yesterday who entered her nursing program or nursing school at age 40. And she admitted it was eye-opening for me to go to nursing school. I had no idea how the body worked. I didn't have the faintest idea. And it was so eye-opening and exciting to learn how all of the systems in the body works, et cetera. So you have to understand that your patients have no idea what's going on with their body for the most part. And for them then to understand, and they all understand the word inflammation. I've never had anybody look away or kind of look crooked when I say inflammation. I think probably because the television talks about inflammation and the different drugs that address inflammation. Point is that these people understand inflammation. They don't really know what it is. They just know the word inflammation. Inflammation is bad. And if you can get rid of the inflammation, that's good. That's, they don't need to know the pharmacology of it. They just need to know inflammation is bad. And if you get rid of it, it's good. And in this case, inflammation causes all the symptoms of TMD. And if you decrease the inflammation, the symptoms go away, and that's good. So they have a better understanding of their own body, whatever that picture is that they pull up in their mind of inflammation. Doesn't have to be a pharmacological picture or a biochemical picture, but they have some kind of picture, and then they understand the inflammation goes away. They can describe it to others, and they feel good about it themselves. They understand pretty much how their body works. So, that's the concept that I wanted to get across today. It's pretty simple. I don't want to beat this to death, but I do want to say a little bit more about how this works in a practice. In practice, in our practice, how I've learned this information by talking to patients, listening to patients, following through to the point where they don't have the inflammation, don't have the symptoms anymore, and why it is very, very important for the patients. Of course, you, the doctor, understands this. You have the technical knowledge to understand about inflammation. If you don't, you can Google it and read all about it. I've had several recommendations for papers I'd like you to read if you want to get into the concept of inflammation a little deeper. But the patients need to know, and you need to spend the time, whatever is necessary, getting them to understand how this works. And I promise you, when you do that, when you take the time to get the patient to understand what's actually happening here, you're going to have a happier patient. They're going to follow the protocol much better, which is important. Remember, this is just a tool. They have to follow the protocol. And that's a secondary, very important benefit, is you will get the patients to then follow the protocol much more closely and not argue with you about, well, I can't wear it 24/7. No, they will follow it carefully when they understand exactly what they're doing. They feel they have control over it now. They are controlling their inflammation. Much better than a couple tablets of Motrin. Ibuprofen will control their inflammation over a much longer period of time. It puts the patient back into control. And where do patients, whether they know it or not, what do patients really desire? Especially in their health care. They want to be in control, and they should be. And the best way to put the patient in control is to make sure they understand what's going on. And they are in control, they feel in control. You'll be a better doctor because of it. They will be a better patient because of it. We will be able to have this problem solved faster throughout the United States and in the world in a very simple way, in a very effective way, as soon as possible. And that is my message for today. As always, I appreciate your attention. I hope that what I said today really strikes a chord with you, is meaningful, that you can apply it. It is quite simple. The Urbanic device and protocol is not magic. Nothing magical about it. If you'd like to talk with me about any topic, if you'd like to criticize, if you'd just like to discuss, I can be reached at Tony@tmjservices.net. Our Director of Marketing and Education can be reached at Naomi@tmjservices.net. And our website, which you are invited to review, has a lot of information about who we are, what we're doing, is www.tmjservices.net. Until next time, I am Tony Urbanic, and this is TMD Demystified.